Welcome to CS Mott Children's Hospital. We are honored that you've chosen our team to care for your family. This video was created to help you prepare for your child's cleft palate repair surgery. We encourage you to read through your craniofacial patient handbook and take advantage of your pre-surgical clinic appointments to ask lots of questions so you can be prepared and comfortable knowing what to expect before your child's surgery. On the day of surgery, you will check in on the 4th floor of Mott Children's Hospital at the surgical check-in desk, also known as the frog desk. Next, you and your child will be taken back to our pre-op care area. Once you're settled in, you will meet with members of both the surgical and anesthesia teams. Oftentimes, the anesthesia team will give your child some medicine, either by mouth or nose, to help them feel sleepy and less anxious. Of course, this may not be necessary if your child is feeling calm and relaxed. Once in the operating room, an anesthesia team member will give your child medicine through a breathing mask. Your child will fall asleep soon after breathing the anesthesia gases through the mask. While your child is in surgery, you will be given a pager or phone from the pre-op area so that you can easily be contacted during or after surgery has been completed. While waiting on level 2 in the surgical waiting area, you will also have access to our cafeteria, family center, and gift shop. Once surgery has been completed, the anesthesiologists will begin waking up your child. Your child will be moved back to the post-anesthesia care unit, otherwise known as the PACU, where nurses will monitor your child closely, watching their breathing, airway, and blood pressure levels as they continue to wake up. Once it is determined medically safe, you will be paged or called to be reunited with your child in the PACU. There are a few things you may notice right away. Your child may have swollen lips, and there may be bloody drainage from their nose and mouth. This is very normal and expected for this type of surgery. You will also notice that your child will have a nasal trumpet placed in their nose. This small plastic tube is stitched in place to help protect your child's airway while they recover. Another thing the surgeons do to protect your child during recovery is use a small thread or suture to keep the tongue from blocking their airway. The thread will be taped to your child's chin, so you may notice that as well. These safeguards make sure that your child has a clear airway should there be additional swelling of the throat or tongue after surgery. The nasal trumpet and suture are typically removed that evening or the next morning. Your child may also be wearing no-nos or elbow restraints after surgery. These prevent your child from sucking their thumb or putting their fingers or anything hard into their mouth. It takes approximately 3 weeks for the palate repair to heal. Therefore, while at the hospital or at home after surgery, your child may need to continue to wear their no-nos, especially if they have a finger-sucking habit. Initially, your child will receive pain medication through their IV. Once your child can tolerate liquids by mouth, they will be switched to oral pain medication. While Tylenol alone is sufficient to manage pain for most children, other pain medications may be recommended or prescribed by your physician if needed. You and your child may stay in the PACU for several hours. When your child is very stable and their inpatient room is ready, your family will be transferred to a private patient room where you, your PACU nurse, and your inpatient nurse will exchange information about the surgery and care needed. Once your child is in their hospital room and ready to drink fluids, care must be taken to keep the newly repaired palate free from harm. Often, fluid is given at first through a syringe with a small red tube connected to it, called a Red Robinson. The red tube should be placed in the side of your child's mouth. Once your child is tolerating fluids, they may drink out of a cup without a sippy spout. They may also have pureed foods from a spoon. Be sure to feed your child yourself, only letting the spoon go just past the lips and not deep into the mouth. Most children are ready for discharge from the hospital after 1 or 2 nights, once pain is under control and they are breathing easily and taking liquids well. You will most likely need to return to your child's surgeon within 1 to 2 weeks after surgery to make sure that the palate is healing properly. We hope this video has helped you feel more comfortable about what to expect from your child's cleft palate reconstruction surgery. If you have any questions at any time before, during, or after your stay with us, please let any member of your care team know, and we will be happy to help you.